we are delighted to have none other than Dr. Daniel Githinji. Remember, on Mondays, we also try as much to focus on health matters, and ulcers is one of the matters that we'll be looking at this morning. One would want to say that, yes, for the longest of time, we've had conversations as pertaining to ulcers, but today we want to dig deeper and we just get to understand what is there beyond the basics that, every time you're told if you're stressed, if you are under, depression, you would land yourself into ulcers. You're always reminded, please make sure that you eat foods that do not have lots of gas. You're always told, please make sure that you do not get yourself into so much thinking, avoid troubles, make sure that you're always smiling. But just how important is it for us to understand ulcers itself, whether you have ulcers or whether you've not been diagnosed with ulcers? As doctors would tell you, we all are potentials of getting ulcers because of the lifestyle difficulties that we get to have. And so Dr. Daniel Githinji will help us unpack this as we get to understand some more, especially on the prevention aspect. Dr. Thank you so much for creating time to be with us this Monday morning.
Yeah.
Karibu sana, and it's been a long time since we last heard you.
Yeah.
For a moment, probably the people who are watching might have forgotten you. If you don't mind, kindly introduce yourself to us.
Okay.
Once again.
Hi viewers, my name is Dr. Daniel Githinji. He came all the way from Kawasukari.
Yes.
So whoever is listening to me today, it's good to know that the topic today is all about ulcers.
Right.
Yeah.
And so, Dr. Ulcers in itself, perhaps the definition, people will say in Swahili, vidonda vya tumbo. But most of the people do not get to understand so well, maybe unless you are diagnosed with ulcers, is when now you ask the doctor, can I get to a space where I'll understand some more about ulcers? So what exactly is ulcers?
Ulcers, they are wound, they are sores, open one. Ulcers, they are wound. And different from the normal wound that you can get maybe in the heart, maybe in the leg, or anywhere else. But that one, ulcers, is the wound that is inside your intestine. We call it tube muscle, from the mouth up to the anus. That tube muscle, it's where that we found that there is ulcer. And ulcers, they are the one that is called, there's normal ulcers, and there is different types of ulcers according to where it develops. Yeah.
All right. And so what really gets us or get people to have ulcers, which is very common today?
We have like peptic ulcers and esophageal ulcers and duodenal ulcers. Okay, there are so many types of ulcers, but the common one, there are three: duodenal ulcers, peptic ulcers, the gastric ulcers, and esophageal ulcers. Yeah. So there are three common types of ulcers. Yeah. There are many, but three, they are so common.
Right.
Remember ulcers, also we have cancer. Yeah. After ulcers has been prolonged for...
So it could develop to a cancer?
Yes.
Okay.
Now, you remember that colon cancer, it's number 3 in Kenya.
Right.
So, colon cancer.
Okay.
Through, it is developed stage by stage. So, when we have 3 types of ulcers, I find that you ignore the symptoms, maybe for a span of 3 months, 4 months. Finally, you develop the ulcers. Yeah.
You speak of the symptoms. Perhaps one would want to assume that maybe you have symptoms and you really do not know whether these are symptoms for ulcers.
Yeah.
And sometimes it's not just ignorance. It's not that you feel pain and you want to overlook it. Maybe it's just lack of knowledge. So when you speak about this is symptoms that people could be ignoring, what exactly are you referring to?
Maybe you are diarrheaing, constipation.
Okay.
Maybe you can see a stool with a blood or a black one, because you have ulcers. Maybe they are bleeding, the blood is metabolized, so you may not see the blood. So you'll still see the black stool. So you may not understand whether you have ulcers or not. Heartburn, pain in the lower abdomen or upper, headache, vomiting, blood or vomiting normal, and losing weight.
Right.
You find that span of 1 month you may lose like 5 kg. That is one of the symptoms that you need to check on. There are so many symptoms according to individual body condition. Yeah.
All right. And so these signs and symptoms would emanate from what exactly? That what are some of the, you know, obvious causes of cancer that perhaps when you take this food, then there are chances you're going to risk getting cancer, that perhaps when you think, like you write, I mean, they always tell us that when you're stressed and when you're overthinking, then you would start developing cancer. Is there some truth in that, or it's a myth?
I may see it's a myth because there is no a certain food that you can take or you have been taking that can cause cancer. We normally see a patient with a certain disease with now the certain food can damage the intestine. For instance, you are taking a lot of, like this time of COVID, people have been taking a lot of lemon. After taking lemon for so long, it can injure the lining. After they injure the lining, you can find that there is a certain wound. That would can, as the day goes, you are still continue taking the same lemon, and there is a wound now. Then it might turn to infection. After they infected the area, then it can develop to a cancer. It is have three stages. Stage 1, injured, inflammation, might be something to do with tumor. There is also another one, hernia. There's so many things that can happen there. But that is the last stage. You know, ulcers, there are 2 types of ulcers. The one for the injured, the another one is about the Helicobacter bacteria, the main cause of ulcers. If it's not treated for a span of 1 month to 2 months, it can develop ulcers. After the stage of ulcers, now you find you have ulcers, H. pylori, and now stage 3, it can develop other diseases. Yeah. So for instance, Helicobacter is a common bacteria that you can find Kenya. Even if you say that about H. pylori, you find that even children, they know about H. pylori. Like every Kenya has been taking the medicine for H. pylori. Kids, so all the kids that in the country, people know about the H. pylori more. They know more about the kids. They have been taking for 2 weeks, 3 months, like that. But what we normally see, the main cause of ulcers is Helicobacter pylori. Okay. Yeah.
All right. What does it feel like? Even before we look at the symptoms themselves, you know, you have ulcers. What exactly does one get to feel? Any form of pain, and where exactly do they feel this pain, and what kind of pain? How does this pain kind of feel? Because, you know, sometimes you could experience some sharp pain, then they disappear. Sometimes you fear some burning sensation, then it gets to disappear. That it becomes hard for you to get to know exactly what the problem is, even before you get to the doctor.
Yeah. Number one, you start experience a pain after meal. Slight pain, or when you eat food, you feel that they are not well metabolized in the stomach. They are not, you feel like there is a bit heartburn, a certain during the night, especially during the night, discomfort, lack of uncomfortable, and even when you are the food they are eliminating from the, you are eliminating the food in the body, you don't want to feel well. That is constipated, diarrhea, or even sometimes you lack of sleep. Because of those are just early stage of H. pylori. Lack of appetite still is there, and mostly in the morning. since you ate yesterday, around, let's say, around, you eat 1 hour before sleep or 2 hours, you in the morning, you'll experience that still you are okay, you don't want to eat, yeah? And finally, after 2 hours, you feel that you want to eat something. So meaning that when somebody is suffering from bacteria, they are in discomfort in the stomach. Even when you are traveling long distance, you'll find that you are vomiting. For instance, there is a certain area that you feel that you are sweating. Sometimes even you are sweating legs due to problem of stomach. But what I'm trying to say, these are just early symptoms. And so many people think that they have ulcers, but they have the symptom that leading to H. pylori or to ulcers.
Okay.
Yeah.
All right. And so once you get to the hospital, who's the right person to see for this diagnosis? And once you get that diagnosis, then what is the way forward? The
first thing is to check, there look-like diseases. Like there is blood bacteria, share the same symptoms. There is typhoid, amoeba, and many others. You may think that you have ulcers. Instead of go and buy the medicine over the counter, I can advise people to see the doctor, general physician. After that, then you may know, after the test, the first test, a blood test, then we can see like ultrasound, endoscopy, colonoscopy, those tests after, one after another. So it should not be done at a go. You should not take medicine without knowing exactly what you are suffering from. Yes. All right. And so once you get to the doctor, they have conducted this, then you're certain that it is ulcers. Yes. What process then begins officially? You're given medicine, you're instructed on some of the meals that you're supposed to take, the ones that you're not supposed to do. And does it get to a point where one can totally be healed? Is there hope for that? Yeah. Ulcers is not a death sentence. Okay. Ulcers is a disease that you can be treated within span of 1 month or 1.5 months, and you'll be okay. Reason why people they are treated and they are not getting well, you have been taking the PPIs, antibiotic. The body is used to those antibiotics. Remember, when the treatment, when you are taking the medicine for the H. pylori, is a bacteria. You need to treat H. pylori as a bacteria. You need to treat ulcers as a wound, open sore. You need to treat it as, so you need to take 3 types of medicine. Okay. 1, antibiotic, PPI, and another one for treating the wound. So if you have problem with the H. pylori and you are treating the wound, it will not going to heal. To heal. Okay. So you need to know exactly, I have the H. pylori, I have treated the H. pylori, it is now over. Now let me start medicine to treat the ulcers. Okay. After the ulcers, there are also another damages. After you have been taking those antibiotics for long, yes, there are those damages that already it is in there, in the tube muscle. So you have to look at it. Now, I need to change the food now. This is kind of the food that I need to take. A span of 2 months. I need to avoid this and this and this. Because if you're not going to do that, you'll be taking medicine year and year. And you'll say that there is no treatment of ulcers. Reason why, the body is used with those antibiotic, antacid, and many more. Yeah. All right, and this is very, very important that one can take medication, and also there's damage and side effects that would come with that medication. And so as medics, when you diagnose someone with ulcer and you put them to medicine, do you put them to medicine also in consideration to what will be the after effect? And at what point then do they get remedies for what is likely to be the after effect after they are done with the medication, or during the medication? The food is after the medication.
Okay.
Reason, okay, there are things that you need to avoid. Like if you are taking medicine, any medicine, you need to avoid alcohol, smoking, and we recommend only water and tea, normal tea. Anything with bottle, anything you don't need to take anything. Like soda, those juices, yeah. The reason why we are saying that, remember, you may have ulcers that they are open. So for instance, you take something, there is a lot of, the mucosa is not more there. We call it in Kiswahili tidikari. The mucosa is not there. The good bacteria is not there. So whatever you take, it will damage the intestine. The mucus look like sanitizer, something like sanitizer that help to metabolize the food. If it's not there, the wound is open. Whatever you eat will damage that wound or that sore or that ulcers.
Wow.
So for that reason, that's why we avoid some foods for a span of maybe 1 month. After 1 month, you can take everything.
And we'll come to that. We'll come to the foods that one is supposed to have when they have ulcers. But just how long would it take for the wound to be healed or for the ulcers to be healed? Because the few times I've interacted with the people who have ulcers will always tell you that theirs is a game of managing, and that the ulcer does not ebb away in totality even after they are in medication. And that is like years after year after year. Are there stages, like you say, when one gets to ignore, maybe the wounds become deeper and deeper, and therefore it's a higher stage before one gets to start medication? Or there are stages that one can start having medication that are early stages, and then they're guaranteed of healing? And if guaranteed of healing, just what is the duration as a medic that, once someone comes to you, they tell you they have ulcers, or you diagnose them with ulcers, then you can give them a certain duration until they are to experience healing in totality?
Yeah, there is a duration of 1 month to 2 months, depending with you have ulcers, you have H. pylori, the bacteria, and also you have ulcers. Furthermore, you have been taking the PPIs, antibiotic for long, so you have to stop taking antibiotic for a month. So that when you are going to take anything for the H. pylori will work for you. If that antibiotic will not going to work for you, no way the wound can go. So that's why we find that so many Kenyans, they are saying that I have been taking medicine for like 14 years. And still the ulcers is there. H. pylori is there because the body is used to that medicine.
Yeah.
So you have to give a break of maybe 1 month so that the medicine you can start now again. Without that, no way you can treat ulcers. And ulcers is simple to treat. You have to know exactly you have ulcers. There is this type of ulcer, like esophageal. Esophageal ulcers, it is common in gastric ulcers. The reason why, when you eat something, the first stage, it is the mouth. We have the mouth ulcers, and also the esophageal within the esophagus. This is the tube. This area part of the body, it is where that everything that you eat pass there. If, for instance, you are taking medicine for malaria, medicine for any other diseases, it has to pass here. For instance, there are capsules you didn't take well with maybe 2 glasses of water. The capsules might be open itself, where exactly here.
Yeah.
So, or tablet or whatever, it can burn that area and finally injure the area, and you get the ulcers. So it's good to know when you have esophageal ulcers, the first thing, you manage the food, and it is very easy to treat the esophageal ulcers because you need to take more water and also stress-free life. Stress-free life is where that you live stress-free life.
Doctor, easier said than done, one would want to say. Yeah. How does one accustom or position themselves to say that, you know, these are stresses of life and they're bound to be there, but I can overlook and get myself to that space where I can confidently say, now this is stress-free, that some of these things that would affect me, I can avoid in these ways and that?
We have our Thika Road here.
Yeah.
It has the bump. It is our highway. It has bump. We have our airport, we have another one, expressway. It has a stopover. In life, there is no where you find that your life is going like a straight line.
Yeah.
You need to understand, if you are passing through a situation, there is somebody somewhere passing the same problem. Even if you may not understand, you think that you have a problem today, yeah? There is somebody somewhere suffering with the same problem or more than the one you have. And furthermore, you find that there are people that they are billionaires. They are suffering also. You are like, they are down. You think that people are not struggling. So when you are struggling, you have to know that there is somebody else struggling.
Yeah.
So you put your life free. Where that, if your life is free, don't think more about your problem. Don't focus about your problem. Focus on, how am I going to solve this problem? How am I going to come out of this problem? Then from there, some cases you'll find that the acid reflux, they are not going to affect you. Because I find that life has to be continue. It has to be going on. And after this problem, there is another problem ahead of you. After that one, there is another one. Even next year, there is a problem. Like our country here, we have a problem with the drought. Now, next year, we don't know whether we have a problem with that. And there is a problem after problem. So you have to solve your problem within your area before you think people will solve your problem.
That's true.
Yeah.
Okay. Well, fair enough. And so you speak of the do's and the don'ts for an ulcer patient.
Yes.
In this process of treatment. Well, try as much as you can to avoid stress.
Yes.
But generally, what are some of the other things that I know an ulcer patient should not really do? And what are some of the foods that they should not take? We start with the do's and don'ts.
Don't eat spicy food. Spicy food, don't smoke.
Okay.
Any alcohol. And also there is something that you need to know. Don't buy any medicine over the counter. Any medicine, even if it's for malaria, even if just go and see the doctor. Okay. Without the doctor advice, don't take any medicine. Okay. If you realize you have a small problem, stomach metabolism, just as good to know public food, avoid them. That is, there is a wedding somewhere, avoid that food. Since you know I have a problem with my stomach, then I should avoid the food because it is I eat the food that in the public, I didn't sleep, those, yeah? Nimekula chakula kwa public, si kurara. Yeah. I should avoid the food first. Yeah? Right. The reason why, if I avoid the food, then I'll be okay. Another thing that you need to know, ulcers, they are, there is that bacteria called H. pylori. Okay. Caused by water, food, poor feeding, and many more. So poor feeding, like I find that ulcers is within the people that we, let me use the word poor, mostly, because they take like some point, they take food around 9, they sleep on 9:30, 30 minutes. The food take 3 hours to be digested. Okay. So mostly poor people, they have ulcers more than rich people. Oh. Yes.
So it's advisable to take food early enough.
Early enough.
Rest so that the digestion process can take place.
Yes.
Before you get to rest.
Yes.
Okay. Specific foods. For instance, I hear people say that, oh, well, when I take skuma wiki, then my ulcer inaamka. When I take this and that, my ulcer inaamka. So what are these specific foods that one should run away from? And what are these ones that are encouraged in as much as you don't have to like have them spicy?
Okay. Patient with ulcers or gastric should take food with high fiber. Patient with ulcers should avoid skuma wiki and lemon, orange, coffee, and mostly black coffee. High protein food like meat. Avoid a lot of sugar food like cake and many more. Those cake with a lot of the cakes,
Right.
Sugar thing.
What if someone has natural sugars?
Yeah.
Natural sugars, say like honey, you have a fruit that is sugary. Is there anything wrong with that?
Yeah, because the reason why we avoid protein and sugar, because when you have problem with ulcers, we realize that you don't have enough mucus or good bacteria that help to digest food. Mostly, there is a bile acid. The bile acid helps to digest food. If you happen to have problem with the ulcers or gastric, automatically you don't have problem. You have problem with the bile acid. So in the gallbladder, there is less bile acid, and in the gallbladder, there is more gallstones. So the less bile acid, the less metabolism.
Okay.
So you find that the patient with the metabolism problem, with the constipation and diarrhea and many more. The reason why I'm saying diarrhea and constipation, it is due to bile acid. It is very low. Now, the reason why I'm saying that you should avoid the food with the protein and sugar, because the body is not in a position to metabolize well sugary things and protein. And if you is like that, you'll find that when you eat that food, automatically heartburn, pain, until that food will leave the body. Yes.
Okay, so there are chances that then this would get worse, or the ulcer could get worse, and what would be the triggers of the thing?
When you see that when the ulcers will be like worse, we call it that you need an emergency treatment to see the doctor. Number two, for instance, your ulcers, they are bleeding or vomiting. That is an emergency. You don't need to ignore when the ulcers, they are bleeding or you are vomiting. Because when you vomit the blood, it can be more, and it can cause also the death. Yeah. Okay.
All right. So we come to the question of treatment.
Yes.
Which would be very, very important. One wants to understand that, fine, this is the medicine that I am taking, yes, but it's quite a process that would perhaps take me a year or two. Yes. Before then there's that healing, and also as I get to treat other conditions that could have otherwise appeared in the process. How then do we get to discuss that aspect of treatment? At what stage?
For instance, patient has been taking medicine for like, let's say a year or more. And the lining is so weak. Even the medicine that patient will take, instead of treating the patient, it can injure more. Because the lining is so weak. And we need to know, take a history, clinical history, that this patient has been taking this medicine a number of years. And due to this medicine, every medicine has its own side effect. So we look at it. If this is the medicine that you've been taking, now, meaning that these are the side effects, that's number one. And now, if I'll continue taking this medicine, this is what I have seen with this patient. Now I need to avoid this medicine. I need to take this one a slightly lower than that one. I give a break of maybe from 10 days to 1 month. Reason, that's why the body regain the energy, regain the mucus, so that you can treat that patient. But without that, you can't treat the patient.
Right.
Yeah. According to the medicine.
Okay.
Some cases the patient is taking other medicine, not only for the ulcers. You are taking medicine for high blood pressure, for diabetics, maybe for the arthritis, and you have been taking for maybe 20 years, 30 years. The medicine that you are taking has caused this, has injured the tube muscle or the lining of the colon. Now we need to know this patient. You can't tell the patient to leave the medicine for diabetics or high blood pressure. So you give a certain method that PPIs, you take PPI for like 10 days. Then after the PPI, you start the treatment of the ulcers.
All right.
Yeah.
Okay, Daktari, there is one person who's asking, can Daktari be a little bit more clear on the difference between gastritis and ulcers?
Okay. Gastritic, there is esophageal ulcers. There is gastric ulcers, duodenal ulcers. And also there is gas. The body can produce a certain gas. Maybe you have eaten like getheri, nyama for like 10, after 10 to 1 hour, you sleep. What will happen is the body start, there is a certain gas you start experience. That is not ulcers. That gas, due to the bile, is very low. So what you need to know, you can take antacid, maybe for a week, then the condition will disappear. Yeah.
Okay.
If you have problem with the gas, you need to take for like, let's say, antacid for a week, then it will disappear.
Okay.
Yeah.
The risk factors to ulcers, for instance, and in terms of, the possibilities of perhaps a population getting ulcers, of a majority of people within a population getting ulcers.
We normally see if we can give the correct answer for the patient of ulcer, people can be very shocked. It's like if a government today inaweza fanya msako everybody to search whether you have medicine, you can find that the quota of people of Nairobi, they have medicine in their pocket. Yeah. Antacid and other. So they are taking medicine over the counter. And this is a risk to our health, risk to our generation, because you find that you are taking a certain medicine since you didn't have enough money to see the doctor, so you decided to take antacid, is 10 bob, and for a day, you continue taking, hoping that you get money. After you take antacid for more than a year or two, you can't live without antacid. The more you take antacid, it damages your body completely. You find that you can't be treated because that antacid, the immunity start going down, and also destroying the tissue. So it will take like a year or more to be treated, because it, for instance, there are those patients that they have a problem with gastric ulcers, esophageal ulcers, and duodenal ulcers, and also they have hemorrhoid, because you have damaged the whole tract. After this, so it is like the end of the day, you find that you are anemic. Anemic can cause death. So after taking medicine for long, it may cause the death. Yes.
All right. One Githinji is watching and says, Linda, kindly ask Daktari to help me on this. I am dealing with drug abuse and abuse of substance, and therefore I am trying to recover from the same, but also I have ulcers. And in the process of recovery, it becomes hard for me to literally wake up and say that I have stopped taking alcohol, I've stopped taking cigarettes instantly. How can I manage my situation in the sense that I am able to still get some of this substance, but at the same time, bit by bit, take medication of ulcers to that level where I'll stop taking the substances in totality?
Okay, if a patient was taking like any drug, you need to take more coffee.
More coffee.
More coffee.
Okay.
And if you are smoking daily, you can take a tea. You continue taking
It will
tea.
come in the place of the caffeine, the tar and all, yes?
Yes. You continue taking coffee gradually.
It will help with the crave.
Yes.
Okay.
Coffee and tea. That's all.
It will help reduce the crave.
Yeah.
Perhaps away from ulcers, can that also be helpful for someone who's battling addiction?
Yes.
Okay.
Coffee is good. And also the tea.
Right.
You need to have, you are used to take alcohol. You need to take coffee. Will
it not be also a form of addiction?
Yeah. Okay, now, when you continue taking coffee daily, still it will become the same problem. But you'll avoid, you know that you are coming from this to this. So avoid taking, okay, for instance, you are taking alcohol daily, start taking coffee daily. After 3 months, reduce the coffee. After the next 3 months, reduce up to 1 cup. Then finally, you find you're okay.
Okay.
Because we can't give medicine to reduce the hangover or anything, to reduce that crave of alcohol. There is no medicine that can work as a alcohol. There is no drug that you can use to help to reduce the alcohol in your body. Okay. Yes.
All right. Interesting. On the question of attacks, frequent attacks that we always have, you find someone tells you, "Well, ulcers zimeamka." How can people get to avoid such attacks?
Okay. Now, there is simple thing that you can do in your house. You have a big G, you can chew the big G.
Okay.
During the even night.
Okay.
Not necessary that you have a heartburn, you can chew the big G at that moment as you wait to see the doctor, instead of taking medicine. And also you take maybe 2 glasses of water, then you'll be okay.
Okay.
Yes.
All right. And so that in a huge way will help with the attacks. In the moment of attack.
Yes, the moment of attack.
Now, I'd also want to understand that someone says, "Well, ulcers zimeamka zinaniuma and everything." What difference is one supposed to do apart from taking the medicine?
Yeah, exercise.
Exercise.
Yeah.
In this moment of attack, you are in pain, Daktari.
Yeah.
This is an ulcer patient who's in pain.
Yes.
Maybe they've taken something that has triggered the pain. Maybe right from nowhere they've had thoughts that have triggered the pain. Maybe just randomly, then the pain arises. At this very moment, what are some of the things that one would go for as quick remedies to ease the pain before you get to the doctor? And I mean, sometimes that's why people will go to the over the counter, because they already know, well, if I go to Dr. So-and-so, this is the kind of medication they're going to give me, so let me just go straight to the counter.
You can massage backside, this backside. Number 2, during that attack, you can sleep with left side, not light side. You lie down in light side, then you can do exercise that learn or something that will go with a high speed than what you are feeling. For instance, you have ulcers and or a gas that is giving you, you are not breathing well. You start exercising yourself like this, like this, to relieve the gas. Yeah.
Okay.
Just the attack will go immediately.
All right.
After maybe 2 minutes. Yeah.
All right.
Simple exercise.
Okay.
Yeah.
There are attacks that are a little bit severe. In that case, is it advisable to go to the next medic?
Yeah.
Yeah.
In any attack, there is something that you need to do. As you are way to see the doctor. Yeah, any attack,
Okay.
you need to see the
Any
doctor.
attack, not necessarily an ulcer attack.
Yes,
Okay.
any attack, you need to see the doctor.
Okay.
But there is something like for ulcers, you need to do exercise. You are in your house, it is night, do just an exercise,
Yeah.
waiting to see the doctor in the morning, if there is no any way to see the doctor during the night. Yeah.
Ulcers can be serious, like you started by saying that sometimes if not well attended to, or if not well medicated or treated, then this can escalate to a level of it being a cancer. Just how more serious is ulcers for the people who are watching, and what is this ultimate thing that you'll tell them would guarantee them that ulcer can literally go away if well managed?
For the years that I've been treating the ulcers, I have realized if you miss the test, you miss the treatment.
Okay.
And that is a major problem for Kenyans. I find that they miss the test.
The test.
They miss the
treatment.
The treatment. And you need to see the doctor. I guarantee ulcers is not death sentence. It is a simple to treat. It take a few days and you get well. It is, you need to change. You need to change the way of treatment. And when you change what the body has been used, even there are those patients take antacid for a year, the medicine is not working anymore. So they take the medicine is not working. Without the medicine, they take like let's say 100 mg, it's not working. They overdose 500 mg, they are not working. Even 1,000. Finally, they find that the medicine are not working. Why? Because the body is used to that medication.
Okay.
Yeah.
All right. Those ones that have ulcers and also have other conditions, like you said,
yes,
there are instances where they'll have to treat for the conditions that they are suffering from first before they get to ulcer treatment.
Yes.
But some conditions really you cannot just overlook the ulcer treatment for purposes of these conditions because it would take long for one to get healed. How does one get to create that balance? Well, upon special advice from the medics and even special focus on the women who at some point in life then they would become pregnant, and so one has ulcers and they're pregnant, and sometimes when you're pregnant you're discouraged from taking medicine just anyhowly. How do we go around that?
What we normally do and what we normally say, when a patient is suffering with let's say like high blood pressure, like problem with arthritis and the blood sugar, you may be taking the medicine for the blood sugar, the same time for high blood pressure, the same time for arthritis. And you remember for arthritis as painkiller. And when the patient is taking a painkiller, you find that painkiller, they have a lot of steroids. Yeah. That's why we say that a patient should not take non-steroid medicine. Then the patient is suffering from ulcers and also the H. pylori. So there are like 5 diseases. That patient, even if you are going to treat that patient, what you'll do, a simple thing, you'll start with the H. pylori. After the H. pylori, then you go to the ulcers. Automatically, when you treat the H. pylori, the blood pressure you lower automatically. The blood sugar will lower automatically. Remember, the high blood pressure, it depends what you have eaten yesterday. Yes. And also the blood sugar. It is all about food, metabolism problem. Yeah. Because you have problem in the pancreas. The reason why the body did not have enough bile acid, or the pancreas did not have enough bile acid to produce enough insulin. That's why you have problem with the diabetics. So if you treat a metabolic problem, even the blood pressure will lower automatically. So many patients with other diseases, you find that when you treat the stomach, the blood pressure normalizes, the blood sugar normalizes. So the first thing is to focus on the cause of the ulcers, And like I find that kuna watu wananiambia ninanuka mdomo, bad breath, and it is a common symptom.
Yeah.
You don't have other symptom. It is only that bad breath. So what you need to do, you need to see the doctor and to know there is a wound somewhere that is not that is not disturbing you. So you need to take that medicine. Now you don't have a H. pylori, you have the wound. Maybe there's a certain meal ulikura ika injure the intestine. So kwa hivyo that area that has the wound or the sore or ulcers has to be treated and the condition disappear.
Okay.
Yeah.
And so that means it could get, and in fact that was my next question, what happens with ulcers and bad breath? Is it that common that people with ulcers will have bad breath?
Yeah.
Or there's a way this then can be controlled?
Not controlled, to be treated. To
be treated.
Yes.
You have to treat the wounds from within.
We treat the wound first.
Yes.
After treating the wound, then the bad breath disappears. Yeah.
Okay.
Yeah.
Well, that's interesting. Family and the people around you. Because sometimes we tend to overlook some of these very, very important things. Because you see, even the stresses of life will come from those ones that are around us.
Yes.
When you have been diagnosed with ulcers, just how important is it for the environment, for the people around you to also understand this, so that even if they are interacting with you well, they put that into consideration, in as much as, of course, we're not saying that you should be accorded special treatment?
For the H. pylori, you need to inform the family member because it's a bacteria.
Okay.
For the ulcers, you may not inform them because if you have a H. pylori bacteria, even your family members, the immediate family member, the one that you live together, because you are using you share the same things.
Right.
They might have the same problem. So what you normally do is that if you have H. pylori bacteria, should be very keen when you are using the plate, spoon and everything for like 7 days. After 7 days, now the bacteria, you can't infect anybody. Because if you have H. pylori, even your family member, you can find that the same bacteria is within your family. But for the ulcers, normally it's for individual body condition. Yeah.
Okay. How do you check yourself for stomach ulcer? One person is asking before you decide that now you can go for treatment or for consultation.
First is to take patient history, clinical history.
No, we're talking about now do I call it self-diagnosis? How do you, she asks, how do you check yourself for a stomach ulcer?
Before you go to the doctor?
Yes, perhaps.
No way that you can treat yourself because some point you may have a symptom that look like, I said look like.
Yes.
Like
okay.
Like I said that.
You mentioned a couple of cases, amoeba, typhoid, that would resemble, yes. And
like cases of blood bacteria. It is look like the typhoid symptoms and also ulcers and H. pylori. So you may think that you have blood bacteria. You may think that you have ulcers. And you don't have ulcers, it's the gastric. Yeah.
Is it genetical? Are there instances it is? Because you find that very young children really also get ulcers.
Mostly they are not.
They are not.
Because for instance, a baby should, a baby should not take food for the last 6 months.
Okay.
After the last 6 months, 7 months should introduce a certain meal.
Okay.
Like porridge and fruit and whatever. But you find other parents, they introduce children within 5 months, 4 months, and even a month. The intestine did not develop the way.
Okay.
So at the end of the day, you may find that the food they are eating the baby. So you find the baby is crying every time, and the baby is not talking because of the The intestine did not develop well.
Okay.
So the patient might experience ulcers and many problems related with the stomach.
Okay. All right. Well, that's interesting. Dr. You know, time is moving very, very fast. And definitely before we come to a close, we'd love to hear what are the take-homes for us this morning as pertaining to understanding ulcer, getting diagnosis, the aspect of treatment and care above everything. What is this one thing that you'd want to tell the people that are watching this morning?
I can tell whoever is taking medicine now, medicine related with the stomach, maybe over the counter, maybe you happen to see the doctor describe a certain medicine for a period, then still you are continuing with that medicine. You need to go back and to see doctor immediately. The reason why, that medicine that you are taking daily, the body you should metabolize food normally without aid of medicine, or without anything to help to digest food. When you mess up with your metabolism, you can mess up completely. And the end of the day, you may find that no medicine can help you. So if you are taking medicine now, please go and see the doctor.
Yeah.
The reason why I'm saying that, you can't take medicine for H. pylori more than 2 weeks. You can't take medicine for ulcers more than 1 month. So whatever you are taking related with the stomach, I can urge you, go and see the doctor. Why? Maybe that medicine you are taking, it is still damaging you, or you have a certain condition like, arthritis and many more. That medicine that you are taking, maybe it has cafe, it has some of the medicine that have non-steroid, like brufen and many others. Those medicine can injure the lining. After the injured lining, then you can have outs from the wounds. Then we can see other factors like even cancer, hernia, and maybe even you need a operation. Yes.
Okay.
Yeah.
Well, Dr. Ari, thank you so much for speaking to us, as we look forward to also have you some other time to get more as pertaining to the conversation. Your contacts, just in case someone would be having a question for you this morning as pertaining to ulcer or anything else medically.
Yeah, someone can call me, 07200 500 77. Simple number, 07200 500 77.
Really? 07200? Yes, 07200, that makes sense. 500 77. Simple number. Where are you located?
In Kahawa Sukari.
Kahawa Sukari, you said, yeah?
Yeah, 4K Plaza Building.
4K Plaza Building.
Yes.
Thank you so much for speaking to us, Doctor. I must admit that it was a nice session and helpful for that very matter in terms of getting to understand some more as pertaining to to ulcers, and also understanding how dangerous it would be if not treated or if not attended to. Dr. Daniel Githinji, it was nice talking to you this morning. It was about beyond the basics of ulcers, and I hope that you've picked something. Just in case you're joining us right now, not to worry, we have this on our social media platforms. The hashtag is Morning Cafe at Linda_Lela TV47KE across all the social media platforms. You can always go on YouTube or on Facebook, Twitter, Periscope to see that important session that we have just had. Exactly 25 minutes past the top of the hour. It's at this very point that we start closing the business of the day, not in totality, because right here on TV47 there's still so much lined up for you, so don't you go anywhere. As for me, I'll get to see you again tomorrow on another special segment of Morning Cafe. Otherwise, do enjoy yourself and have a lovely week ahead. My name is Linda.